The World Health Organization has warned that vaccine nationalism will slow the global recovery from COVID-19. It's urging countries with a good vaccine supply to pause their immunization programs once vulnerable groups have received their jabs. It comes amid an ongoing row over delays to COVID vaccine supplies in the European Union. Following a backlash, the EU has reversed a decision which would have prevented exports via Northern Ireland by temporarily suspending part of the Brexit agreement. Experts from the WHO, who are investigating the origins of the coronavirus in China, have visited the hospital in the city of Wuhan, where some of the first patients were officially diagnosed and treated. The team plans to visit their labs, markets and hospitals in their remaining 2 weeks in Wuhan. The military in Myanmar has promised to abide by the country's constitution following 2 statements which prompted fears of an impending military coup. The army alleges that there were irregularities in last November's election victory for Aung San Suu Kyi.
The major U.S. stock indexes each fell about 2% today, while GameStop and AMC continued their rally. The Dow Jones Industrials tumbled 620 points to slip below 30,000. The Nasdaq Composite lost 266 points. The S&P 500 fell 73. For the month of January, the Nasdaq gained more than 1%, but the Dow and S&P both finished in the red, according to MarketWatch. It was a volatile month with markets buffeted by headlines about COVID vaccine supplies and tightened lockdown measures around the world. At the same time, new coronavirus variants are showing up across the globe, raising questions about the effectiveness of those vaccines and lockdowns. Meanwhile, the trading frenzy rolled on for GameStop and AMC Entertainment. GameStop rose 67% Friday and closed out January up more than 1,600%. AMC gained 53% today and more than 500% for the month. Hedge funds that had short positions on these stocks have taken a beating, while retail investors, many new to the markets, have cashed in as they drive prices ever higher.
We begin with the coronavirus pandemic. Taiwan has reported the first COVID-19 death in 8 months amid an outbreak of new cases. Health authorities said on Saturday 1 of 4 people who had tested positive has died. The victim was a woman in her 80s. She was placed in quarantine after a nurse living with her tested positive for the virus. The woman was confirmed to be infected on Friday. An infection cluster broke out at a hospital in a northern area earlier this month. It involved doctors and nurses who had treated a coronavirus patient. The patient had returned from overseas. 19 people have tested positive. Some family members of those healthcare professionals are among them. Observers say Taiwan has contained the virus relatively well. Cases had not been confirmed there for an 8-month period through late December. The Lunar New Year will be celebrated in Taiwan next month. Authorities are worried about the possibility of another outbreak as increasing numbers of people are returning to the island to enjoy the holiday. Investigators from the World Health Organization have visited a hospital in the Chinese city of Wuhan. They want to see what steps the government took in an effort to control the spread of the coronavirus. The team met with doctors and nurses at the facility on Saturday. Many seriously ill patients were treated at the hospital during the initial stage of the outbreak. The experts then visited an exhibition hall for 2.5 hours. The hall served as a temporary medical facility when the infection was spreading. The building is now being used to showcase the activities of medical workers. It is also being used to highlight the efforts of military staff members who built a makeshift hospital. Observers say the Chinese government is trying to justify the measures it took to contain the spread of the virus. The team has not yet inspected a seafood market where a cluster of infections occurred. The members have not visited the Wuhan Institute of Virology either. Some U.S. officials believe the virus may have leaked from the institute. The investigators plan to stay in Wuhan for about 2 weeks. The world's first coronavirus cases were detected there. The team wants to identify the source of the virus and the infection route to humans. But it remains to be seen how forthcoming China will be when the WHO asks for information. Turning now to Japan, officials in a prefecture near Tokyo have recorded what may be the country's first cluster outbreak of a coronavirus variant prevalent in Britain.
4 more cases of the coronavirus variant reported in Britain have been confirmed in Saitama Prefecture.
3 of the infected people have connections to a workplace. Other people at the same site were determined to be infected with the variant earlier. The Japanese Health Ministry believes the cluster occurred at the workplace. In total, 7 people there were found to have contracted the same strain. Meanwhile, another case of the variant has been confirmed in Tokyo. It involves a man in his 50s. 15 of the people infected with the variant have not visited Britain recently or had known contacts with someone who traveled from the country. Tokyo reported 769 new infections on Saturday. The number of daily cases has fallen over the past week, but the medical system remains under strain. On Saturday, authorities reported more than 3,300 new cases across the country. The daily death toll topped 90. Over 970 people are in serious condition. The resurgence of coronavirus infections has prompted some people in Japan to stop using nursing care services. Care providers are concerned that reduced use of the services could cause the physical and mental health of the elderly to deteriorate. A woman in her 80s lives by herself in Tokyo and has been mostly staying at home. She used to go to a daycare facility once a week to exercise and chat with others. But she stopped going in December. She has also stopped going to hospital for her heart treatment.
I would visit my doctor if it was a matter of life or death. But now I'm afraid of getting infected with the coronavirus.
A government survey of more than 1,700 nursing care companies nationwide found that as of the end of July, about 82% of them said elderly people were refraining from using their facilities. In another survey in May, more than 500 caregivers providing at-home care were asked if they knew of elderly people whose health had declined after they stopped using nursing care services. 62% replied yes. In the United States, data compiled by Johns Hopkins University show daily new cases are declining across the country. Some U.S. cities have moved to ease restrictions. Health officials in the western state of California reported more than 60,000 new cases for a single day in December. The daily numbers have fallen to around 20,000 in recent days. On Friday, Los Angeles County officially lifted its ban on outdoor dining. Some restaurants reopened patios for the first time in about 2 months. Authorities in New York City have announced they'll conditionally allow indoor dining at restaurants on February 14th if the rate of positive coronavirus tests continues its downtrend. But some health experts are concerned such moves are premature.
Cases are dropping down now. We still have an enormous amount of people getting infected. I think we should have stayed in the stay-at-home order.
Professional baseball pitcher Tanaka Masahiro is rejoining his former Japanese team after playing 7 seasons for the New York Yankees. Tanaka explained why he chose to return 8 years after he led the Tohoku Rakuten Golden Eagles to win its first title. He expressed his thoughts about the 2011 disaster that struck Tohoku in northeast Japan, where Rakuten is based.
I saw meaning in becoming a free agent for the first time in my career, right before the 10th anniversary of the disaster. I could have chosen any team, but the timing, ahead of the 10th anniversary, has a special meaning for me.
Tanaka marked double-digit wins for 6 straight years with the New York Yankees, a first for a Japanese player. Tanaka has 177 career wins, 99 in Japanese professional baseball, and 78 in the major leagues. He became a free agent at the end of last season after wrapping up his 7-year contract with the Yankees. Tanaka said he wants to come back and pitch in Japan while he's still at the peak of his career. He said he's excited to show Japanese fans how much he has improved.
I know the stakes are high, but I want to live up to people's expectations. That is one of my most rewarding things, and win as many games as possible to meet high goals.
Tanaka also said he wants to take part in this year's Olympic Games.
I could not have taken part if the Tokyo Olympic Games had been held last year. If I'm chosen for the national team, I would have no reason to refuse. So I really want to participate.
Those were the stories for this hour.
Here with the latest on the pandemic, which is accelerating across the planet. According to the World Health Organization, there have been more cases reported in the past 2 weeks than during the entire first 6 months of this crisis.
The U.S. has now confirmed nearly 26 million COVID-19 cases, meaning about 1 in every 12 Americans has tested positive for the virus. And the CDC issuing a new order overnight requiring face masks for all travelers using public transportation, which will take effect for the start of Tuesday.
And there are hopes a new vaccine could be on the horizon. Johnson & Johnson plans to request emergency use authorization from the FDA as early as next week. ABC's Trevor Ault is at Yankee Stadium, which is being turned into a mass vaccination site for New Yorkers, with the very latest. Trevor, good morning to you.
Good morning. With the CDC now says 27 million doses of the COVID-19 vaccine have been administered nationwide. The rollout is slowly gaining steam after its sluggish start, but this virus is not going to wait around for us to pick up the pace. And now the focus of many health officials is on the new variants that are spreading around the world and here in the U.S.
This morning, the U.S. racing to develop herd immunity as coronavirus continues to mutate and evolve. 434 cases of the UK variant have now been detected in 30 states, as well as the first cases of a variant from Brazil and 2 cases of a variant from South Africa. But Dr. Anthony Fauci says the variant he's most worried about is the one that hasn't happened yet.
You could always make a vaccine pretty quickly with this advanced technology that you could address a given mutant. But it is concerning.
Johnson & Johnson says trials for its vaccine show efficacy takes hold in 7 to 10 days. Its 66% overall efficacy is lower than its counterparts, but it's shown it could be up to 100% effective in preventing hospitalization and death.
With more vaccines becoming available, then we will move more quickly to immunization of the entire population and herd immunity, which is what we need to stop this pandemic.
Unlike Pfizer and Moderna's vaccine, Johnson & Johnson's is a single-dose, one-and-done shot, and it doesn't need to be stored at sub-zero temperatures. On average right now, the U.S. is vaccinating 1.2 million Americans a day, and FEMA is now providing $1 billion in support to vaccination sites. But so far, only 7 states have vaccinated more than 10% of their populations, and many locations are desperate to find the necessary staffing.
So we would really love help with individuals who are medically trained and non-medically trained.
In New York City, Yankee Stadium is opening up as the latest mass vaccination site. And amid positive trends nationally, Governor Andrew Cuomo says the holiday surge has ended. Now restaurants can reopen to 25% on Valentine's Day, with weddings at 50% capacity a month later.
I don't want to create any personal pressure, but here's an idea that you may want to consider. You propose on Valentine's Day, and then you can have the wedding ceremony March 15th.
And so far, the Johnson & Johnson vaccine has shown to be effective against every mutation of the virus we can test, though its efficacy did drop against the South Africa variant. And all of this is playing out as the CDC now projects next month we will eclipse 500,000 American lives lost to COVID-19. We already lost 90,000 this month alone. Eva?
Those numbers, Trevor, thank you.